who can be better than Dr. Rahul Rajiv sir to guide us how to approach medicine in, sir, next, couple of days left with us. Please guide us on that, sir.
Thank you, Rajidavan sir and Raja Mahindran sir.
Hi, sir.
So I'll try to keep it very concise and crisp on what my suggestions will be for you preparing for the last few weeks for the exam. So first of all, medicine is a vast subject. And if you feel that, you can revise the entire portions in just 5 days, it might not be possible. So you have got to think wisely. How am I going to revise this subject? So I would say that the revision should be centered mainly around the previous year topics. So you look at the previous year topics and you center your revision based on that. But remember one thing, when you look at the previous year questions, you will find that every question paper has certain outliers. Like you draw the normal Gaussian distribution. Some questions will be extremely tough. So don't generalize the paper based on certain outlier questions. So it is like majority falls in that 95%. So I would say that you please focus mostly on the easy and moderate and maybe slightly difficult questions. So focus on those topics, revise your notes, and just trust yourself. Because I'm sure that when you revise medicine, suppose you take 4 days or maybe 5 days for revising medicine and maybe the associated allied specialties, you will always have a tendency for lateral reading. But I would tell you that, restrict that tendency. When you learn about one particular topic, you might want to go more into it, but no, that is not the time. So you try to go in a straight line without too much of deviations. So previous year questions, previous year topics, forget the outliers. Then whichever platform you have followed, I'm sure the faculty would have given you flowcharts, line diagrams, summary points. Please focus more on that. Because if you go for the detailed lecture notes, again, it might be time consuming. If you have listened to my classes on arrhythmias, I come to a final basic approach on the approach to tachyarrhythmias, approach to bradyarrhythmias, where in that one flow chart, everything is summarized. So please go through these summary tables rather than going through the exhaustive lecture notes. Then one more suggestion is when you go through these previous year topics, it will be nice if you can quickly go through the allied subjects as well. By which I mean, suppose you are learning treatment of myocardial infarction. You can quickly brush through the anticoagulants and antiplatelets in your pharma as well, because then that will help you connect better when it comes to clinical scenario-based questions. So I think though a proper system-based approach may not be possible in the shorter time frame, and believe me, like you will always have that feeling of incompleteness. Even if there are 3 weeks, or even if I give you 3 years to study, the last couple of weeks, you would always think I need a few more months. That is definitely going to happen. So nobody has ever attended the exam with a complete reading, just like you did in your school. You would finish everything, maybe 3 rounds of revisions, but that is not possible. So accept the reality that you can only go to the exam hall with a bit of incompleteness, but always remember when you learn, just try to keep your composure. And the vast topic like medicine or a vast subject like medicine, you try to go through areas you are likely to forget. If you are having certain weak areas, just think, okay, arrhythmia topic, I'm not so good in it. Just go through it a few days before the exam so that even if you see an ECG question, you're not on the back foot, you are on the front foot to play the shot. So I think those areas which are likely to trouble you, just go through that. If you're having doubts in the management of stroke, just go through that. If you're always confused between iron deficiency anemia and thalassemia minor, how to differentiate, we know that always question comes from that. Just go through that table differentiating iron deficiency, thalassemia, and anemia of chronic kidney disease. There has to be a question from that. Never neglect the basic topics like pulse, JVP. Quickly go through these abnormalities, and that is enough. Okay, so I would always tell you that in the remaining time, remember each subject, devote a specified time frame, and within your capacity, please do your best. but don't get unnecessarily stressed out that you could not revise entire medicine, because one thing good about all the clinical sciences is that certain questions you will be able to answer reflexively. Like even if you did not read, if the clinical scenario is that of a ST elevation myocardial infarction, you will remember at that time, okay, this is what my faculty told me. This is what the window period is. Okay, I will go for this management. So this is not a theory exam. Certain questions will come reflexively. You will be able to answer. So that is what I want to tell you. So I think, it's all about maintaining confidence.